So, hello to everyone. We are going to start our 17th session of Listen and Learn webinar. And today's speaker is Dr. Suneel Krishnan. And he is talking regarding spinal disorders. So, without further ado, let me welcome Dr. Suneel Krishnan. Over to you.
Thank you. Please allow me to share my screen.
Yeah. Can you try now?
Yeah. Okay. Kayena vacha manasendriyeva buddhyatmanava prakrite svava karomi yatyat sakalam parasmai narayana ismataya. So very good evening to everyone. It's a nice opportunity to be part of this Vishabhakti program. It's being conducted by my beloved juniors. So coming to the point, so we are going to talk about spinal disorder. So what is the importance of spine? So apart from the medical significance, which you are mostly familiar with, there are some other significances. The way the spine has evolved into an image in the public life. For example, you call an animal spineless when it is not upright, when it doesn't have enough courage. When you don't have any value, you call him spineless. So spine has become a symbol for uprightness, honesty, and other values. It is very important to note this point because amidst all the mammals, all the animals, humans have the distinction of standing erect. Of course, there are some primates like chimpanzees, apes. They are also standing erect. It's very important from the evolutionary point that we stood erect. That's the reason for our dominance. That's the reason for probably for the destruction also on the other hand. Okay, so that's how we got hold of the power to control the world as such. So we have significant, we are indebted significantly for the spine for this evolution because we stood erect, we used our two upper limbs for constructive purposes, and to the evolution we have our own thumbs. Thumbs have evolved rapidly, and thumbs, the evolution of thumbs is a big story behind our distinction. Okay, so spine is a distinctly human feature, I told. And any development, anything which is unique, it is also a barrier in another sense. What happens is that we have to pay a cost for our privilege. So this happens because since we are standing erect, we are against the gravity. Our entire body is against the gravity. So naturally, we have to pay a price. Our weight-bearing joints, like the lower back, the knee, and the ankle, they get affected. So whether you like it or not, being born human, when you are going to age, and as age proceeds, there will be definitely a burden in your weight-bearing joint that everyone will be suffering from some or other spinal disorders, lower backache, or something like that. So this is the cost which we have to pay. And from the yogic and chakra point of view, you know the chakras, they are told in the context of spine. They are said to be present in the spine, and the Sushumna, Ida, Pingala, all the knots. Spine is very important in the yogic and tantric philosophy. And that is one thing. So this is just some music, general music. We will go to the anatomical view. So this is overview of the spine. I'm not going into too many details. So you have the division, the vertebral division, cervical vertebrae, thoracic vertebrae, and lumbar vertebrae, sacroiliac region, coccygeal region. Coccyx is supposed to be the tailbone. So these cervical, thoracic, until 7, 12, and all the numbers are there. You are very familiar with these things. And what you need to observe is that spine is not erect in its own nature. It does have gentle curvature as the anatomical feature. There is a slight bump in the cervical region, and again there is a slight bend in the lumbar region. So this is very important because if there is this bend goes beyond the proportion, if the bend is in the lateral side, you call it as scoliosis. If the bend goes in the front side, you call it as kyphosis. Kyphosis is a kubjatome in Ayurveda, they say, hunchback. So, and the other diagram, that is very important. See, from brain, you have spinal cord. It's like, a tree branch, and all the nerves are coming out from the spinal cord. And these nerves, they come out from the intervertebral disc space, intervertebral space. So between these bones, the vertebral bones, there is a space. This space is cushioned by an intervertebral disc. So this disc provides a cushion-like structure. It prevents the friction between the bones. So if there is a disturbance in the intervertebral disc, there will be problems with the corresponding nerves. So for the arms, you get your nerves from the cervical region. For the legs, you get your nerves from the lumbar region. Coming to the cervical spondylosis path. Okay. So now, I just want to concentrate on two main conditions, which is related to the spine. It is very common to us. One is the problem in the upper portion of the back, upper portion of the spine, cervical region, and the other is on the lower portion, that is lumbar region. So I think we can just focus these two so that it will be more beneficial. So both the cervical and lumbar region, there are several problems related to these. That there can be a possibility of osteoporosis, where the bones turn very fragile, very brittle. This is more common among the women, especially post-menopausal, because it is very closely related to estrogen mechanism. And then because of that, there will be some stress factor, and there is a constant low backache. Those are the symptoms of osteoporosis. And you have infective arthritis or autoimmune disorders. So those are the other two disorders which we need to take into account, especially rheumatoid arthritis, ankylosing spondylosis. See, ankylosing spondylosis, it is very, ankylosing means fusion of spine. So there will be a fusion of spine. Mostly it happens in the cervical region, where there will be complete stiffness, and it will be very difficult to rotate your head like this in both lateral sides. You have to turn your entire body. There will be severe pain, and the pain will also worsen through the night, and there will be severe morning sickness. One important feature of almost all the autoimmune joint disorders, like ankylosing rheumatoid arthritis, there will be severe morning stiffness. When there is very you feel difficult to walk from the bed, to stand from the bed. There is a severe pain. Then you have to suspect some autoimmune involvement. And the other disorders are there. So degenerative disorders. So degenerative disorders, you don't have problems while getting up from the bed, but as you walk, the pain will be more on further movements. Whereas in rheumatoid and autoimmunological disorder, the pain will be slightly relieved as you walk. So this is one significant clinical difference which you you can apply even in the knee pains also. This is very useful. Okay. So some of the causes of the bone problems, aging. So aging, it's like a big rock sliding from the sloping surface. Anyway, it's going to slide down and come down into the pond, to the pit. So anyway, we are all getting age. Astir jayate, vardate, viparite, apachiyate. So these six stages. So yeah. So anyway, it is going to happen. So age-related changes will be reflected in our joints as well. Postural. I think it is very important because nowadays, uh, in the not even in the middle age, you get degenerative problems. You get degenerative problems in the early part of life itself. That is because of postural abuse. So our muscle systems, okay, when we, it's like when you use one set of muscles, if you are a sportsman, you can understand. When you play shuttlecock, you use one set of muscles, and the other set of muscles remain unused. So what happens is that the muscles which you are overusing, they become overused, and the other side of the muscles become abused, and they become wasted. So that's an imbalance. So this happens in the cervical area also. If it happens in the lumbar area also, that becomes lumbar spondylosis. So there's a laxity of the muscles, and hence it is very important to note that we have to keep a balance between balance in the muscles. So that should be proper work for according to our job. So according to our occupation, if there is an if our occupation involves one particular set of muscles, then we have to make sure that we do exercise for the counter muscles. So that's what occupational. If you are a lifter, if you lift weight in your head, then definitely there will be some problems like that. For computer, of course, there are plenty of videos and photos, images which shows the proper height, posture for this idea for the operation of computer keyboard and other things. Now, nowadays the mobile is also a problem because you always tend to extend and flex your head. So head is bowing down, so there will be over extension of the cervical muscles. So, so these are some of the problems. So I think our lifestyle is such like this that we cannot completely avoid these things, but at least we need to be aware and we do the necessary precautions to avoid it. Okay, traumatic when you directly get hit. So it is also important to note that the hitting, the trauma need not happen directly in the cervical or the lumbar region or the spine. It can even happen in the area of wrist or legs or some peripheral appendages. They can also affect because there will be problems with the muscle texture. Okay, so cervical spondylosis, clinical presentation. So we can even apply the same to the lumbar spondylosis also. So there will be localized pain. The localized pain will be in the cervical area, or for lumbar spondylosis, it will be in the lumbar area, followed by stiffness. So stiffness, uh, and then it is followed by shooting pain. This shooting pain is a very important marker. So when there's a shooting pain, you have to assume that there is a compression in the disc. Okay. So when the nerves which are coming out, there is a impingement. So the nerves are we have motor nerves and sensory nerves and mixed nerves. So when there is a problem with motor nerves, there will be loss of movement. When there is a problem with sensory nerves, there will be pain, numbness, and burning sensation and other symptoms. Okay. So shooting pain, and then followed by burning sensation, dizziness. Dizziness is very important, very significant. Dizziness is not found in lumbar spondylosis. Okay, shooting pain and burning sensation are common until these things are everything is common for both lumbar spondylosis and cervical spondylosis. Dizziness is a unique feature of cervical spondylosis. Especially, you ask the person to extend and flex the neck by standing erect. Okay, there will be reduced supply of blood to the cerebral artery here. because the vertebral arteries are found there. If the compression is severe, then there will be reduced blood flow to the cerebellum. Cerebellum is very essential for balance. If there is a problem, then there will be leaking. And then paresthesia. Paresthesia means pins and needles. There will be sharp, generalized pain. And then muscle weakness, of course, and vasospasm and paralysis. This is the last stage. So these stages, except for the dizziness, lumbar and cervical spondylosis have very similar, closely related symptoms. So these also correspond to the various stages of disc problems, disc bulging. When there is a localized pain and stiffness, this is the stage of disc bulging. We can, in Ayurvedic state, you can say as kapha state. And when there is a shooting pain, burning sensation and dizziness, we can state as the pitta state. And from paresthesia, muscle weakness and paralysis, we have vata kapha, avata avastha. So the disc material, disc herniation appears, and then disc prolapse. So disc prolapse. If you suspect if there is a paralysis, okay, Ayurvedic management doesn't work in this manner. I mean, if, not in the normal hemiplegia, when there is a disc involvement and paralysis, because there is a complete prolapse of the disc material. The disc material has come out completely of the capsule. In that case, so whatever you do, it is not going to help. If you have a patient in this state, then you have to go for MRI or CT scan, and then you can advise for surgery. So that is the last resort. We cannot do any help. But till that stage, this bulge and herniation, Ayurvedic medicines, Ayurvedic measures, and lifestyle modifications are of very great help. Okay, so diagnosis. You can diagnose the problem of both lumbar and cervical spondylosis simply by observing the clinical symptoms. There is one important test called Ramworth sign, where you stand erect with your legs in a closed manner in a V shape. You close your eyes and you have to extend your arms sideways, and then stand with a closed eye. Whether there is a swaying body motion, you have to observe. So if it is there, then there is cerebellar avasculation or cerebellar blood supply is very less. And then grip test, you can just ask him to hold some water bottle, whether he can hold the water bottle in a straight manner, without any shivering, whether there is proper hold. And using knee hammer, you can just test the muscle tone. And DEXA scan, I already told about that. X-ray, CT, MRI, I already told about that. Blood sugar is very important. You have to check blood sugar if there is a shoulder, neck stiffness, because periarthritis of shoulder is very common complication of diabetes. So you have to check the blood sugar to rule out. And also diabetic neuropathy also has pins and needles and other symptoms. So extremely rare cases, when you suspect of infection, you have to do CSF study, rule out vertebral TB. That is one thing you can rule out in the normal X-ray because of the cold abscess. Okay. So Ayurvedic perspective, so it's a kapasthana and vata aggravates that, which means above the shoulder. And acute cervical prolapse, you have to consider as avarna, degeneration, you have to consider as dhatu kshaya. So these are the neck exercises. Mainly the flexion, extension, rotation. These are the, you have to hold your head on the, like this for 2 seconds in the maximum capacity. And then you have isometric exercises. So where isometric exercise means the muscle fibers they don't you don't extend or flex them, but without lengthening or shortening the muscle fibers, you are doing exercise. So you have to give resistance from all the directions. So these are very important simple exercises you have to do regularly. This will also help in preventing the problem. Okay. And then so exercises, I already told you about that. Avoid hard and high pillows. That is very important. Dry your head gently after bath, especially for women. And Ruksha Shvedana. This is very simple. You can do it in your home itself. So no need to apply oil immediately for every case. It's not like, Ayurveda is something. Ayurveda of late we think in public perception is that everything is massage. No, it's not like that. Ayurveda, the space for massage in Ayurveda is very, very less actually. It's one part of a multitude of treatment which is suggested. So Ruksha Shvedana. Ruksha Shvedana is dry heat. That's all. So you can use either sand or salt, rock salt or some salt, or just husk of it. So you can roast it in a pan and you can make a pottery, and you can use it to ferment the region which is having pain. It is very good to relieve the stiffness. If there is a stiffness, then there is involvement of kapha avarta. So in that case, the Ruksha Shvedana is very highly helpful instead of going for the oil, hot oil treatment. Okay. So these are the Ayurvedic understanding. We pain, Vata Kapha, Pitta, and Vata Kapha. So physiotherapy will be useful to some extent, especially in cervical traction. When there is muscle wasting, it is very highly useful. If there is no muscle wasting, then it is not of much use. But traction has to be approached with caution, because if you are not doing it properly, then there's a complication. There's a chance of complication. You will end up in paralysis. So clinically, for cervical problem, you can give lumbar traction. That gives a better result. So rheumatoid arthritis, so autoimmune, I'll just give a word about autoimmune phenomena now. Autoimmune means our own immune system fighting against our own cells. You know about there are two sets of cells, memory cells and the fighter cells. So the spies, you can call them spies, they go and they identify the enemy, they identify the microorganisms, and then they inform the fighter cells, the police cells. They have to go and attack. So in autoimmune diseases, these identifier, they misidentify our own tissues as enemy. So hence, it's like internal war. So there is no permanent cure for any autoimmune diseases in any system of life. It's a genetic misprint, we can say. So it has to made away. It has to go away in the same manner how it has come. So it's like it's like Ishvara Kripa or Bhagavan, whatever you want to say. So osteoporosis, I already told about that, and then lumbar spondylosis. So I was telling about this parallelly with the cervical spondylosis. So sciatica is the sciatic nerve there. So if there is a compression at the root of the sciatic nerve, L1, L2, L3, and the nerve will get the sciatic nerve runs through the leg until the toes. So there will be difficulty in pain, difficulty to walk. All those things will happen in sciatica. So actually, for sciatic nerve problem, 1 or 2 sittings of physiotherapy would be very, very useful, very, very easy actually. That could help if the problem is not at the level of spine, but at the level of the gluteal region or some other thigh or some other region. If there is some kind of compression or something like that, 1 or 2 sittings will be simply doing instead of we doing massage and all the other treatments. 2 sittings of physiotherapy, skilled physiotherapist will help. Okay. So these are the general things. What we can do, some simple measures I wanted to share with you. Some asana, like Bhujagasana. Bhujangasana is very, very important asana. This is the posture, snake posture or cobra posture they call it. What is the difference between asana and the physiotherapy exercises. The important difference is in the breathing pattern. Whenever the difference is whenever you extend your abdomen, you have to inhale the breath. Whenever there is a flexion, then you have to exhale. So this rule has to be followed. If this rule is followed, then only you can call it as asana. Simply, it is not extending your body, or it's not an exercise. The biggest difference between asana and exercise is breathing pattern. You have to be very cautious, very careful about breathing. So Bhujagasana, this posture, this will relieve your cervical problem, and to reposition your disc, it will be very highly used. And this Shalabhasana, or the locust pose, this is also very important. It will be a little bit difficult when you have low back pain, but you can do it in a systematic manner. First, you have to lift one leg and the other leg, then you can lift the two legs. Just three turns of this Bhujagasana and Shalabhasana will keep your spine in a healthy manner. It's very highly recommended. And of course, so you have done the exercise, done the asanas for the back. It has to be countered with the corresponding abdominal muscles. So you have Pavana Muktasana. Pavana Muktasana is very important because this Pavana is Vata. So it relieves the Vatic symptoms, Vata symptoms. So Pavana Mukta, it gets relieved of the Vata. Vata is situated in the lower half of our body, and it is very. So any symptom, any condition which has pain, there is involvement of Vata, because Vata is Ruksha Guna and Karaguna, that causes the pain. So Pavana Muktasana is very important. So instructions for massage. Okay, I already told you that not all times we need massage. Okay, because if there is a severe compression, when we do this Kutralam kind of heavy massage with too much of pressure, then we will end up worsening the situation. Okay, so the pressure should not be given the spine. Too much of pressure is not good, especially in the compression. Without knowing properly, we should not do heavy pressure massage. Okay, and also when there is an involvement of Ama or Kapha, Avarta Avastha, massage is not advocated. It will aggravate the condition. So sometimes we can do the massage by adding Saindava Lavana to the oil, because Lavana has this Ushna Guna, and it also Abhishendi and Vidahi, that can help a little bit to counteract the effect. And Katutailam is also Ushna and Tikshana instead of our usual gingerly oil. We can alternate in these things. But anyway, so what we can do, there is a technique in Varma. It is called Purattadavu. Purattadavu means nothing. You just have to massage your spine with your palms, just like, just like from the cervical top end to the bottom, to the coccyx region, over the spine, gently. Okay, that, like you just pat your dog. Similar to that, you have to give the movement from top to the bottom. And it is very important to know the direction of the massage. You should never go from bottom to top. It will be very, this is not good, it is not advised. You always have to do massage from the top to bottom of the spine. Never you should do from bottom to top. So if you don't have any other treatment, if you don't know any other treatment, instead of doing anything, you just do gentle massage of the spine with your palms, just for some 15 or 20 times with some oil. You can prepare some oil with some whatever home remedies you have, like ginger and camphor and milk pepper, all those things. You can, and also garlic. You yourself can prepare an oil and you can use it in the back of the back from your top to bottom. In case of you,
Okay.
so this technique is called Puratharadu. And there is a draped gauze technique. Okay, this I will tell you. We have this.
We have this
Procedure called Kativathi. Okay, that is not very difficult for us to do on our own. So what we can do, we can get a gauze cloth from the medical shop, and you have to fold it, and between the gauze you have to put the cotton, insert the cotton, and you have to for the full length of the spine you have to make the gauze cloth, and then you have to dip the gauze cloth in the heated oil. While heating oil, you have to remember that since Ayurvedic oils are already prepared, I mean they are already they are processed, so you should not heat them directly. You should always heat them by keeping in the hot water, which is with the flame off. Okay, after boiling the boiling the water, and after switching off the flame, then we have to pour the oil in a small cup and keep it in the hot water, or else you can simply use the iron currently to heat, and then you can pour the oil over that. So in that manner only oil has to be heated, and you have to drape this gauze cloth which you are prepared into the oil, and you can simply put them over the spine, and then after some time you squeeze it, and then again you keep the squeezed oil in the hot water, and you take the other part of the oil, and again you repeat some 5 to 10 times, 5 to 10 minutes. So this will actually
relieve your symptoms.
localize massage. Okay, so these are some of the points which I wanted to share with you. Om Sarvesham Swastir Bhavatu Sarvesham Shantir Bhavatu Sarvesham Purnam Bhavatu Sarvesham Mangalam Bhavatu Om Shanti Shanti. If you have any questions, we can discuss about.
Thank you, Dr. Suneel Anna. Thanks a lot for an informative session. So there was this question which came in the chat box. The patient has spondylolithiasis in L5S1,
Okay.
and he was advised surgery. So they've asked for advice, like what we can do.
So spondylolisthesis. In that case, I think actually, as long as there is no complete restriction of movement, complete restriction of paralysis or something like that, paraplegic, you don't become paraplegic. I think you can wait and try Ayurvedic treatments in a proper way. There are some definitely with the Varma and other techniques, you can definitely improve the condition. So I think it is not a must. Just you can consult the doctor and then you can decide.
Okay. Okay, Anna. Thanks again for accepting our invitation, and sorry for the time constraints and all. So thanks again.
Yeah, no problem. Yeah, okay. Thank you. Thank you.
I now request Dr. Sarathkrishna for the vote of thanks.
Thank you. Thank you, Ajula. Is it audible?
Thank you. Thank you, sir. Yeah.
Thank you. Thank you for that valuable time. And we all know that the constraint of the time, that is very shortage in time, and the topic was vast. How much we know that how much you have constrained the topic. Thank you for that valuable time. And I take a few minutes to thank everyone. That was a 2-month journey, 2.5 months of journey, that Listen and Learn webinar series. And that was a wonderful journey. And that time we know, we learn more and more, getting to know people, and we provide our own bit to the society, service to the society, and we proud on that. And we thank all the coordinators for putting their effort to make this achievement event successful, and greatly acknowledge to the chairman of Shubhadri Charitable Trust, M.K. Shashidharan Nayak, for providing such an innovative platform on this pandemic situation. Also, I should thank all our resource persons to come forward and take this opportunity to have a knowledge giving session for the society. And all the sessions have been put into our channel, and all the persons who came into the live sessions, and also in the YouTube channel, gone through the YouTube channel. I thank everyone, and I hope meet you all again in a different platform soon. And thank you, Suneel, one more. And thank you all the coordinators, thank you all the viewers, and the sessions go on through webinar channels, YouTube channels, all who commented and give their feedback directly and indirectly. Thank everyone.
Thank you.
Thank you, everyone.